Hello, everyone. So nice to have you here. Just give it another few seconds just for a few more people to come in a little late. Okay, let's go with it. So, welcome. What we're here today to talk about is GP Connect and how that works with CareLineLive. I'm really delighted to have one of our customers, John Galpin, who is founder and managing director of In Friendship Limited. John is with us. They've been reasonably recently using GP Connect, so he's going to walk you through his experience, both of setting it up and also how they have found it since. I'll just move my slides on so you can actually see some faces there. So that's John, who will be joining us. Well, he's here in the background, but he'll be speaking in a minute. I'm also joined by Jess, who's a sales development rep for CareLineLive. She's done a number of these GP Connect webinars, so she will be talking to you and showing you how CareLineLive looks like in our platform. I'm Marie, I'm the marketing manager, so I'm just really hosting the webinar. I'm just checking questions and all the rest, not doing masses of input myself. And in the background, we have Natalie, who also works in marketing, and she will be helping out with Q&A and putting links into the chat threads and that kind of thing. So just a little bit of housekeeping. We are recording this. If you want to ask any questions, please put them in the chat thread, ideally rather than the Q&A thread. We might interrupt whoever's speaking to answer at the time, but we're probably likely to leave it until a little later on and just answer those questions kind of at an appropriate point. We will be sending you a copy both of the slide deck and of the recording. And we have a number of links which we're going to put into the thread as well. So for instance, John and I met earlier this week and did a little video recording of the DSPT toolkit and how that works, because that's often a big kind of thing that puts people off getting involved with GP Connect. So we've kind of demystified that a little. So we'll put the link for that in the thread. Before I hand over to Jess, let me just talk to you a little bit about CareLineLive. I know that in the webinar today, we've got some CareLineLive customers that know us very well, but there are a number of people that are perhaps with other providers or other software providers, or are currently using, I don't know, Excel sheets, paper-based processes and that kind of thing. So a brief intro to CareLineLive. So we are an all-in-one, very integrated software system. We've got over 700 home care agencies as clients at the moment. We are on the NHS England digital DSCR, Assured Supplier List. These things used to run off my tongue, and we've not been talking about it so much more recently. So you'll find that any software provider on that list does have GP Connect integration, because that's one of the requirements of being on that list. But you'll know that if you have a software provider that is on that list, there's a whole slew of functionality and security requirements that we meet, and they continue to evolve and improve as time goes by. So CareLineLive is founded and developed in the UK. It's a 3-platform system. They're all very integrated. So there's a management platform, which is what providers are using in the office, tending to use their laptops or desktop PC for that. There's a mobile app for carers, and then there's a portal for families, so that we continue to communicate with important stakeholders there about visits and that kind of thing. The things that sets CareLineLive apart is we're very customer focused. So we actually answer our phones on average in under 20 seconds. And that's not just our sales line, that is our support line that we answer as well. There are other ways that you can talk to us as well. We have an intercom kind of chat system, and you can also email us. Lots of regular feature updates. Customers that are on the call today, we will be sending out a CareLineLive style, our customer newsletter, in the next few days. And that's got a bunch of new features that have gone live in the recent weeks. So we'll be explaining more about them in that newsletter. And when you come to CareLineLive, you get one system, you get everything for the price you pay. There are no additional add-on costs. So for instance, GP Connect is included free of charge. It's part of what you pay for. Okay, I am going to hand over to Jess. So I'll put myself nice and quiet and I'll click the slides and Jess will talk to you.
Fabulous, thanks Marie. So ultimately GP Connect is designed to help facilitate the complete circle of care between you, the care provider, and the NHS GPs. So what it does is it will share patient information with the appropriate staff to enable you to deliver care. CQC registered providers only, so unfortunately it's not available in Wales, Ireland or Scotland or anywhere else currently. Maybe they'll adopt it in the future, but right now it is not on the agenda too. And you can see either a full view or a restricted view of a person's GP records. But to be able to do so, you need to have a digital social care record in place like CareLineLive, and you need to have the standards met on data security and protection toolkit, which I know John will go over a little bit further a bit later in this webinar. Can you do the next slide, please, Marie? Ultimately, how it works is you will input your client's NHS number into our system. It will request data from GP Connect. It will pull it through and display it. Now, we do not have a huge amount of control over how this is displayed, but I will show you in a bit more detail if I just take over control of the screen on what ours looks like. Can you see, hang on, let's get it to share the right one. There we go. Can you see my screen okay, Marie? Thumbs up, cool. So to easily get onto it, you can just search for the client in question. So I have the lovely Florence Nightingale and all of her information here. And to get started, you need to make sure you have the consent by your client or their person of contact. So you can go on here easily to give the choices, click on GP Connect, accepted, decision date, any comments, who authorised this choice, whether it was themselves or the next of kin or their power of attorney, and you can also put evidence to show that's a signed form, just to really demonstrate to CQC that you've done your due diligence and you're being compliant with use of GP Connect. But GP Connect itself, so my one is 100% demo environment. This is not real data. So we can see that it's actually flagging that there are some issues with what I've put in for the data of Florence and to what GP Connect is saying. So for example, the GP details, GP Connect says it's missing there, and it can also flag like if the NHS number isn't put correctly into the system. It's very useful on that front. So this is the overall summary that you'll see, and this is basically the gold mine of the part of the platform itself. See her birth date, gender, NHS number, address, and I'm missing some key information there. We have the summary of the last 3 encounters. So we can see that she's had her clinical consultation report come through, and she has also had, this is actually adapted, my demo of the things changed, that's quite cool. So the active problems and issues, we can see that she's had salbutamol, excuse my probably horrible mispronunciation of that. She had flu-like illness there, adverse reaction to gluten-free cracker toast, and her medications. Now for the encounters, you do also have a filter by date, which, as I know on the next slide, which I forgot to go to, we will go over who can see what in a bit more detail. But ultimately, if you have a nurse qualification or a social worker, you will see all of this. However, if you are a registered manager, you will only see the top 3. and we can go into a bit more detail on what that is. So there's then the clinical items. So where is she, what's she been doing? What tests has she had recently? Is there a social worker involved? How alert is she? How's her blood pressure reading? So you can make notes on what really you should be having into your care plans for her, and if something needs to be monitored. So if the doctors have, say, flagged her blood pressure reading and they've not relayed that information to you by a member of her family, or you just didn't know anything about it, you can see on here that maybe it's something you should add to your task to check the blood pressure regularly. And we can see a flu-like illness and that she has asthma. So this is all something that you can add to make sure that your tasks and what you're doing on your visits is accurate, and keep up to date with, say, things for your email. What medications should she be on, which is a bit further down. We have our problems and issues. So asthma is a major significance. How long has she been experiencing it for? Any illnesses that she's had, any allergies she has. So especially with the gluten-free cracker toast, we can make sure that you're not providing gluten in any of her meals that you're giving them. And medications. This one is most likely, I'm sure John will say, something that will save you the most amount of time. You don't need to call up to check about what medications they should have, any changes. You can get checked. Unfortunately, the system does not automatically flag if anything's been changed into GP Connect. That's not down to us. That is a GP Connect NHS decision. No one's able to do that currently, but it might be something that they'll look at in the future. So we can see she's got this on repeat. Any referrals she's got going on. So she was referred to the clinical allergy service. Observations. So this one's good to show if there's a nurse, any alcohol, urine tests, what's been coming up for their immunizations. So poor old Florence, even though she has got asthma, she last had her flu jab back in 2018. So we need to get her in because flu season is here. And administration items, which is not something that is on our demo environment. So I will stop sharing this part and we'll go back to the PowerPoint, please, Marie.
Yeah, sure. Let's just share screen. So this is showing you who can access what.
Yeah, who can access what. So it does show you the last 3 GP practices practiced, and what I've basically shown you there. Pharmacists do have a lot more visibility, but I doubt there's a pharmacist on this call. Should we go to the next slide, Marie?
It's fair to say, Jess, when we've talked to other providers that have used this, and it'll be interesting to see what John's view is. The last 3 encounters are generally enough.
Yeah.
And actually, from a lot of service users actually don't want you going back into their dark history, because there may be things that they would rather conceal from you. So that can be a benefit. John, if we could just bring you in here, do you have someone in friendship that has full access to it? How are you finding it in terms of full or part access?
So we're fully restricted access, and for us and what we do for our clients is perfectly fine. To your point about customer or clients not wanting a full medical history, absolutely. So when we began exploring the consent and advertising this service to our clients, that's one of the first questions: is how much of my medical history can you see, and how far back are you going? And me personally, if I was on the other end of that, I wouldn't want someone that I don't know or a company I've just started to work with to have full access to my records. That's private to myself. So generally, we actually find that the last 3 encounters is absolutely all we need.
Yes, exactly. I have found that it's people that are doing extreme complex care, maybe hospice care, that does find the last 3 encounters more useful, because they're having more GP encounters more regularly. So those 3 encounters could have been in the space of less than a month, so they want to know a bit further on.
And those kinds of providers are likely to have the qualifications that mean that
Yes.
that they've got the full access anyway.
They will have to have that qualification in place, and then on our system they also have to be granted that permission to see it. So it's not just anyone. So a carer that's doing the visit in person will not necessarily have access to see this unless you've given them permission to. It's usually just the registered managers, maybe the care coordinator, whoever does the care plans. But the benefits, which I know John's going to go into in much detail, is in this lovely diagram that is by NHS themselves. So it does really help you to have more up-to-date information, reduce the drug budget costs as there's less medication errors and waste. It improves access to information at any time. So because this is a 24 hours a day system, you can go in at the middle of the night and do your admin and check people's medications, care plans, rather than doing it in the day, if that's how you roll, without having to try and call a GP because they are not available after 5 p.m. typically. Improve communications between the health and adult social care. So it's really stopping having that divide of like us and them. It's a bit more integrated and gives you increased productivity. But for staff experience, it does have improved referral management and really reducing delays in treatment and allowing it to have more accuracy, because it significantly reduces human error and gives you that great holistic view of your patient or client, whichever terminology you prefer. So it means that you're really able to give them that person-centered care that we're all striving to achieve. So if we just go on to the next slide now, Marie, and I believe it's then the FAQs. So as I said before, who can use GP Connect? It's only for a full view for clinicians, and you'll need to give your registration details for that and provide documentation of your qualifications. It is strictly for England only, and it is included in your CareLineLive subscription automatically. And the main benefits is how it's something you can access instantly, and it's only able to be accessed in direct care for your company. You'll need to capture that evidence as the service user has given you that permission for the record to be assessed. They are very strict on this, and it is something that they will or should be monitoring you, CQC, when they do their inspections to make sure that it's not being misused. And yes, CareLineLive is part of the NHS Digital Social Care Assured Supplier List.
Lovely. Thank you very much, Jess. So if we can ask John a few questions now, that would be really helpful, I think. So John, tell us your experience of GP Connect. Once you were set up, we'll go through the setup thing in a minute, but how have you found it as a provider?
Yeah, brilliant. If I start with kind of the pain points pre GP Connect, the biggest kind of pain point was just the time spent chasing down for updated prescriptions, either through clients directly, client families. But I think most people on this call will recognise the pain of having to call GP surgeries and waiting on hold for 45 minutes to an hour is often the case with our local surgeries. To get through to the receptionist, to then have to bypass the receptionist to get permission for a latest update on medications. So it's such a real time-consuming effort. So there was other means we went through our own carers to find out what the latest prescription was and the medication, to see what medication was currently in the client's home, to then try and build out a picture of what should be added to their MAR charts. Those are kind of the time-consuming efforts that we undertook. The other side of it, I think, with initial care assessments that we conduct. So we go and visit a client families, and gather lots of information to build up a profile about each of our clients. And then it would get to medication, and then we would then spend time then having to document the medication and get all that information. But the kind of narrative now changes as part of that initial care assessment to say that we've got GP Connect. with your consent, provided we can actually gain access and have a live view into what medication you currently have and what you're currently, the current medication and any changes going forward as well. So that cut out quite a lot of time as part of that initial care assessment. And then obviously now with GP Connect, we can come back in and then we have live view and visibility into everything: medical history, last 3 encounters, any allergies and or adverse reactions. All of that can be directly fed into our care plans now, and saving us, I think I said to you, Marie, probably 2 to 3 days per week on average of chasing down different individuals and clients and their families.
If we can just contextualize that, because 2 to 3 days a week would be, it depends on how big an organisation you are. So just tell us how many staff you've got, how many hours of care you're providing.
Yeah, absolutely. So we're a team of, there's 22 of us and growing. We've got approximately 63, 64 clients at present, and we're delivering about 2,000 hours of care per month.
That's great. I mean, 2 to 3 days a week is just phenomenal, isn't it? Can I ask you about consent? So how did you go through the process of getting those consent forms signed? Or first of all, had those consent forms created?
Yeah, absolutely. So with GP Connect, we obviously had consent forms in place. So pre-GP Connect, we had our support agreement. Clients would sign the support agreement. We would then send out consent forms. We had 4 different blends of consent forms we would send out. So quite a lot of paperwork up front. But going through the process of setting up GP Connect, it then moved us down the route of updating our consent forms. So what we did is actually brought our separated consent forms, included GP Connect into our consent, and then brought that into our support agreement. So clients were presented with one document up front covering all of our terms and conditions, the service that we would provide, and also give them options to tick off against consent. So everything was done up front. What we've also done with existing clients on our old support agreements is we created a single consent form that captured everything around GP Connect and sent those out to those individuals where we required access into their medical history and their medication separately. So we've kind of done 2 exercises: new clients, consent done up front; existing clients, we went out and gained consent separately.
And you used AI to help you create your consent forms, didn't you? Tell us about that process.
Yeah, I guess there's still kind of mixed feelings about AI and out there, and there's people that adopt it, there's people that are unsure, there's people that are afraid of it. I'm very much on the side of using it to help us speed up loads of different things within our care organisation. So I use an AI tool called Claude, so CLAUDE. It's really feature rich. You can talk to Claude, similar to ChatGPT, but it actually goes out and does research into different websites to pull information in. So what I did is actually fed in our current support agreement, our current consent forms, and then I also fed it information around open public information around GP Connect, and also some links to what CareLineLive share on their website. And I asked AI to amalgamate everything into one single document. And then within no time at all, I had back a revised support agreement with a blended mix of consent forms. So it sounds complicated. It really wasn't. It probably took me 10 minutes to tell AI what I wanted it to do. And then 10, 20 seconds later, it then gave me a version that I could then take a look at and then amend in our own support agreements. So yeah, highly recommend AI. Don't be afraid of it. My only advice is just be careful what you do put into it. Don't put any personal data in there. Make sure you retract that from anything you upload, and you should be good to go.
Great. So tell us about the setup process that you went through, because I know you kind of put off getting on board with GP Connect because you were worried about how much time it would take. So tell us about how much time it did take and what that process was like.
Sure. So I was fortunate. The first step really is doing the acronym is DSPT. So it's the Data Security and Protection Toolkit by the NHS. So I did that in 2024. And for those that haven't done it, then encourage you to take a look at the video that Marie and I did earlier this week. That toolkit, when you first open it up, it's quite daunting. There's a lot of questions in there, and there's a lot of actions and evidence items that you have to go through. But I was pleasantly just surprised when I started it, is that when I went through each section of the evidence items within the toolkit, there's lots of links to take you to the data care hub. I can't remember the name, Marie. You have to correct me.
Digital Care Hub, I think.
Digital Care Hub, that's the one. Digital Care Hub, which is packed full of different templates. So information asset register, didn't even know what that was until I went through the toolkit, went through the exercise of completing the template and building out my documentation. So I think going through that process of the data security and protection toolkit, whilst it is quite daunting, it took me 2 to 3 days going in and out, doing sort of sections, coming away, because it can be quite heavy, was a huge benefit. And actually, when I got to the process of setting up GP Connect, I realized I'd actually done a lot of the legwork through the NHS DSPT.
So then when you came to, let's assume that a provider's already got DSPT, because an awful lot of them will have. How much time is it then to then just get the GP Connect bit set up?
I think all in, probably about 1 hour. I think once you've got your consent forms done, that's probably the hardest bit. And again, I used AI, as I mentioned, to build out our consent forms. Once you've done that, it's pretty straightforward. So you're signing on to the national data. I've written it down here because I can't remember the acronyms, but you're signing on to the national data sharing arrangement, which is online. You then grab your ODS codes, you apply that, you set your provider as CareLineLive, and then your setting, for us, it was a home care provider. But that whole activation piece, because you've done the toolkit, because you've done your consent forms, because you've updated your privacy notice, you sign the agreement, and that piece was about probably an hour, just working my way through the agreement to understand what it is and what I'm signing myself up to. Hit the button, and then CareLineLive then take care of the rest. So yeah, really straightforward, and I wish I'd done it sooner.
So if people are CareLineLive customers here, Natalie, you might want to just pop that link that was in the PowerPoint deck into the chat thread. You just click that link and that will start the process for you. Or you could talk to our support team, or you could message Jess and she'll get that in process for you. If you're not a CareLineLive customer, but you're interested in doing so, do book a demo with us. We can walk you through a tailored demo of CareLineLive, walk you through GP Connect again if you'd like. And then you can, once you're onboarded with CareLineLive, you can start the GP Connect process really quickly. So we've had a couple of questions. I'm going to start with Jim's because I think John can probably answer this. When a client is discharged from hospital with a change in medication, are the GP records updated automatically and therefore visible on GP Connect?
Do you want me to answer that?
Is that what you found, that they're visible immediately?
Yeah, absolutely. Yeah, they are. Yeah, as long as the records is updated by the GP, then yeah, they're visible straight away. And I can give you actually an example of that. So 30 minutes after getting GP Connect live, we had a client ring up to say their father had gone in to the GP. They had a new medication, and then said, "Oh, would you like me to send you over a picture of the new prescription?" And I said, actually, hold fire. Can I send you my consent form and I can find out for myself? Sent him the consent form, he signs, and then I jumped into GP Connect, and there it was. So yeah, that was 30 minutes after GP Connect was activated, and that was an hour or 2 hours after that GP appointment took place. So yeah, the answer is yes.
Brilliant. That's really useful. So Matt's put the link in there for customers who want to get started with GP Connect. Jim is saying, does the hospital update the records? I guess it's the GP would need to be up. Oh, could you know, Jess?
I know the answer to that from talking to Alison from NHS England. No, the hospital doesn't do that. They have their own system. This is strictly GP notes. So unless the GP has added it in, which they should do soon, depends how quickly the hospital has done their discharge notes, then it will be on there instantly.
Great, thank you. Can you also look at the question from Kirsty? I'll read this out. Read the consent permissions. Does the consent on the CareLineLive consent form, which says sharing information with other professionals, cover this? I think not. I think any standard consent form needs to specify GP Connect, doesn't it?
Yeah, it needs to be a specific GP Connect form.
Yeah, that's what we've created.
So someone has their hand up. We're not actually unmuting people, John. So if you could just write any questions in the chat thread, that would be appreciated. Right, in the Q&A thread, Emily is asking, with the allergies and medications, is there a way for this to pull through to the client's profile in CareLineLive, or is this just for reference? Jess, do you want to answer that one?
Yes, so I did reply directly to Emily, but it'd be good for everyone to know. It will not automatically pull through and amend CareLineLive. That is not a CareLineLive decision. That is down to the permissions that GP Connect and NHS has given to those with that integration. What I would recommend to do is you can have multiple tabs up for the client. You have your GP Connect on there and just copy and paste it over.
Great. So does anyone else have any other questions? While we're at it, Jess, have you got any questions for John? John, is there anything else that you'd like to say?
No, I would just encourage anyone to, if they haven't done it already, to get the digital security and protection toolkit done and underway, chip away at it slowly but surely, and then you'll have it done in no time. It was of a huge benefit. We've implemented different forms and templates and procedures, like business continuity plan, so something we hadn't really thought about. So yeah, there's lots more benefits than just GP Connect than by going through that process. So I would encourage anyone that hasn't to get going with it straight away, and to do it piecemeal. Don't do it all in one hit, because it is heavy.
And again, I would encourage people to watch the video that we made the other day, because a lot of those questions are a really simple answer, and if you're confused about the answer, there's a click through to resources that will help you create the right answer. And the other thing I was going to say is, Natalie, I don't know if you remember, one of our Sussex kind of care association partners was offering, if providers, they don't even need to be in Sussex, if providers were needing any help with DSPT, that she would be quite happy to support them. So just maybe message us if you are struggling and want to be put in touch with a third party that can help with that. I mean, she was offering to do that free of charge. Whether that's still the case, I don't know, but we can find that out for you. Right, there are a few more questions. Emily, wanting to confirm that In Friendship is domiciliary care. You are domiciliary care, aren't you, John?
We are.
So she says that historically she's found that GPs are less willing to share information when people are not in the care home. I think GP Connect has kind of got over that, because the vast majority of GPs in the country are connected in England are connected to GP Connect, so it just kind of happens automatically now. So you may find that if you are struggling to get information out of GPs, this is your kind of route through to be able to do it now. John is asking, related to the previous question regarding the change in medication between hospitals and GPs, it is always a struggle to get it in place on time. Took us the whole day yesterday to do so, 2 weeks after the patient was discharged. Yeah, nightmare, isn't it? If the information's got to the GP and the GP's put it on the record, you will instantly get it. Have you found any delays, John, or with the hospital discharge thing?
I'm trying to think. I probably couldn't give you any examples that would be of any help to John, but I'm just wondering whether there's something that we could do to contact the hospital, and whether they would have any discharge notes that they would share with us. That's a good question, actually. I don't have a good answer, unfortunately.
So John's kind of in his last point saying based on his experience, GP Connect is not updated automatically. I guess that's because your GP has just not updated that information from the, with the discharge notes.
Yeah, you are reliant solely on when the GP actually physically updates their system for it to be visible. So I imagine the delay is a human delay as opposed to a system delay.
Any other questions? Yeah, it sounds like it's a not terribly prompt service from the GPs there, John, unfortunately. Okay, let me just people can continue to ask questions if you would like. I'm just going to share a couple more slides with you. We've got some lovely testimonials from John on how he's found it. Oh, someone asked, sorry, I missed this question. Someone asked, what are the greatest benefits for an agency to have GP Connect? What would you say, John? The time saving?
Time saving is the biggest one. Not having to sit on the phone waiting in queues to speak to clients' GPs. So having instant access once the GP is updated the GP record into a live view into medication and medical history is a huge benefit. So yeah, time saving, huge time saver.
Great. I think I have a testimonial from someone, that's the video, someone else on one of these, which, so this again is this one was about time saving. So Alice was saying, we thought GP Connect was just about medications, but it's about so much more. So she's finding not only just the time saving, but the accuracy piece and more confidence in care delivery. And I know when we interviewed Alice, she was also saying that she felt that their whole service looked more professional to friends and family of service users as well, because they were up to date with the information. So this is the link. Natalie has shared it as well for customers that would like to start using it. If you go to our website, you will find the demo button for people that aren't currently customers of ours, and you can book a demo with us. We've got demo space available all the time. So I would love to talk to you. And there are a number of other case studies and bits and pieces if you'd like to look a little bit more. Pictured is Clive. You can see Clive on the back of John's little view as well, along with, this is your in friendship bear as well?
It is, yeah.
So they're making friends. But if you take a demo with CareLineLive, we will send you a little Clive plushie, which is lovely. So we've got a couple more webinars I wanted to let you know about. Our sister company, MOA Benchmarking, have a new feedback and complaints module. We would very much like to show you that, do a quick demo of MOA, really helpful with CQC and CIW regulations and benchmarking. We really strongly recommend using MOA. It's not an expensive service either. So perhaps register at that to just get a little bit of an eye-opener on what MOA can do for you. And then we have a webinar together with Georgina Turner from Inspired for Health. And this is all about how you can improve your compliance. So Georgina is a consultant in the sector. She runs courses on compliance and regulatory matters. So she's doing us a kind of heads up on that. And our home care champion, Marina Martin, is also involved in that. She has just finished writing an ebook around compliance, which we will be making available within the next few days. And we are kind of launching it at that webinar. So that's our closing screen with Clive. There's one more question here from Hayley. Are we able to see if the client has had a medical review in the last 12 months? I don't know if John or Jess like to answer that.
Yes, that should be under the clinical items. It will be, there is a part where it says medical review with the date. The amount of detail you see, I am not 100% sure of. It's not on our demo environment, but I know it is a thing that's shown. Have you seen it, John?
Yeah, I'm just trying to think whether I was looking at the question and I was trying to figure out if it sits within the last GP encounters and whether it's restricted for us or not. I'm not 100% sure. So, for example, yeah, if the last encounter was 12 months ago and that was a medication review, a medical review, sorry, then it would show. I'm just trying to think if it sits somewhere else.
It would be in the clinical items because we have the clinical consultation report in that section. It might get restricted if you don't have the full view though, depending on the time frame. So if it was more recent, then you should see it.
Yeah, sorry not to be exact on that one, Hayley. So Natalie's going to put another link in for you. If you found this webinar helpful, and particularly if you're a CareLineLive customer and you would like to write a review of CareLineLive on Trustpilot, we would love you for it. It means the world to us to get those reviews. So you can either just Google Trustpilot and CareLineLive and write it in there, or Nat will put a link in now for you. Just like literally 3 lines. We love CareLineLive because, or we don't like CareLineLive because, whatever you would like. But generally, we are the highest rated software company on Trustpilot in the UK for home care. But we will continue. We need to have continual reviews to keep that rating. So we'd really appreciate that. Okay, I'm going to close this now. We'll edit this up so that we top and tail it a little bit, and we will send you a copy of the recording, as well as a link to all of those other links that we've shared and a link to John's presentation on DSPT. Thank you very much, Jess, for your time sharing this with us today. And John, thank you so much. I know how busy providers are, and I know you've just come back from a business trip abroad as well, so really appreciate you coming in. Nat as well, is there anything you wanted to add? No, just to say goodbye. Lovely. Thanks so much, everyone. We will be speaking to you all soon, I'm sure. Goodbye then.
Thanks all.
Bye.